And we are now live, Senators.
All right, thank you. This is a continuation of Senate Health and Welfare, January 26th, and we are looking at H1, a bill relating to the management of the care for developmental disability services, distribution of developmental services. And we have with us Commissioner White. Yeah, thank you for being here.
Thank you for having me.
And why don't you introduce yourself for the record and then give us an update as to the importance of our passing this bill and if you'd like to see any changes to it.
Okay, great. Thank you so much. My name is Monica White, and I'm the Commissioner for the Department of Disabilities, Aging, and Independent Living. And thank you for the opportunity to be here today. And also, I think I'll just start with some appreciation for both the House of Representatives for H1 as well as the Senate for the companion bill of S2. The bill, as introduced, was intended to correct an oversight with the drafting of the bill as passed last year, H720, also known as Act 186. In the final days of the session last year, there were some back and forth about which language was agreed upon by the administration and the legislature, and unfortunately the language that was put in the bill that was sent to the governor for signature was not the one that we had agreed upon, and subsequently the legislature agreed to prioritize correcting that this legislative session. So I just do want to extend appreciation for the very prompt addressing of that correction. Specifically, the areas to be corrected include where the bill as passed last year would have required the administration to seek legislative approval for activities such as payment reform and conflict-free case management. And what we had agreed to was to seek legislative input. And so the bill H1 as presented this year does correct that language to reflect legislative input. And then further, I have testimony in House Human Services because the bill is introduced this year. The initial bill included language that honored before February 1, 2023. So like next week, we would present any policy changes related to payment reform and conflict-free case management to the House Committee on Human Services and this committee. And so I went in and testified to House Human Services that that date was not feasible, that we will not have any substantive policy recommendations to bring forth for legislative input by February 1st of this year, and requested that it be updated to February 1st of 2024, which House Human Services did. And my understanding is the bill as passed by the House reflects that change to 2024. So, which we are grateful for.
Okay, and if you go to your web page and you click on bill, you can find the draft of the bill as passed by the House, so you can have it. Questions? Oh, Senator Bullock and Senator Hardy. Senator Hardy, why you go first and then Senator.
Okay. And maybe this might be more of a question for Katie, but the bill as we passed last year had the report date from you as February 1st, 2023, correct?
I believe that is correct.
And my recollection was that was not part of the concerns that were negotiated, and that we had wanted you to come back this year to report to us by February 1st of 2023. This is an issue and an area that there are a lot of people out in Vermont who are very concerned about this, and delaying that report for another year, that wasn't part of the problem that we were trying to address with these two bills, these companion bills. That report, I think, was something that we did expect and that you knew we expected by this date. So delaying it a whole year is concerning to me.
Okay, so what I would say to that is in the event that the bill had passed with the correct language, we would still be coming in this year to request an extension for alignment with the timeline so that the Agency of Human Services is overseeing the compliance as a whole for the agency for conflict-free case management, which extends beyond Dale and in working with the federal government on the timeline for that work. So I'll share that just this month we have actually, let me take a step back. So for conflict-free case management, we engaged with a contractor starting in November for managing the project and coming into compliance with conflict-free case management. So that vendor came online just a couple of months ago. And this month, we as an agency have been soliciting membership for the stakeholder input group. And the timeline as laid out includes a number of deliverables for this year with a draft implementation plan to be available for January 1st of 2024. And so what I would offer is Dylan Frazier, who is the Deputy Director of Medicaid Policy, I believe is his title, who could come in and provide detail on the milestones for coming into compliance at the agency level for conflict-free case management. We absolutely do recognize the importance of that, as well as the fact that it is a huge shift in how we operate, and we, meaning the state's Medicaid programs, operate and contains a significant amount of work for the agency as well as partners with key stakeholder involvement in recognizing that we want to do it, but we want to do it right. So I would offer Dylan as an option to come in to speak specifically to the milestones and where we are at for compliance.
Okay, I think that would be helpful. And I just want to be clear that the sort of error that we're trying to correct wasn't that the dates were not part of that error. That date that was in the bill as passed was the date that we all agreed on last session.
Mm-hmm.
The error was something else. And so I was a little concerned that you were sort of lumping that date into the error.
No.
And I also just, want to point out that the agreement was between the House and the Senate conference committees. And I know that you had input in it, but just to be clear about the process and who was agreeing to things, it was the House and the Senate, the legislative body. And I know that you had input, but it's really important to distinguish between who gets a seat at that table, and that was a legislative decision. So, yeah, because I know that this bill was rife with a lot of separation of power issues. So I just want to point that one out. I think it would be helpful to have more of an update on where you're at with everything rather than waiting a full year. And I don't want to hold up the bill because I know we want to correct the error, but waiting a full year for more information from your shop is, I think, is not fair to the Vermonters who are really concerned about this process.
Sure, and like I said, I think it would be, or I think we would be glad to come in and provide a more robust update on where we are at, the milestones, and the overall work plan, timeline, et cetera. But in terms of substantive policy recommendations, that is coming into development with that significant stakeholder input this year. So the body of work that we would ask for legislative input would be early 2024, calendar year 2024.
Okay.
So yes, let me just ask a follow-up to that, because this is an important distinction that our chair of GovOps is sitting with us. So to these legislative and executive branch issues. But would be very helpful to have some written testimony that would substantiate the need for the changes, both changes, from your perspective. So if we could get that, and that, I think the date is critical because there was so much dialogue last year about when can we expect to see information? When can we expect to see changes? Your explanation is clear. Obviously, we want to stay consistent with federal requirements and others, but so if, can you get us something in writing that would sort of justify the date? I don't know if you already provided it to the House or not.
I don't believe we provided anything in writing
Okay.
about that, although.
We can request something.
Can you
Okay,
do
yeah,
that?
we can certainly have
Okay,
that.
that would be
so
great.
that's-
I mean, we would like to move the bill as quickly as possible, so ASAP, I guess is the, would be great.
Sure.
Good. Senator Gulick.
No, it's no worries. Katie did a good job of explaining a little bit of the history around this bill and so on. But I did some reading last night just to update myself, but can you explain what input looks like, legislative input, real quickly? Because we're moving from approval to input in this bill, correct?
Yeah.
What does input look like?
What I just did is legislative input, what you say in committee.
Yeah, what we
That's-
say in
that's what
committee,
it
what we
is.
put in writing, what we pass out of committee,
Okay,
or could be a request for consultation.
okay.
So if there was an RFP going out, they might look for the input from the chair or the committee as a whole. So it could be a variety of things.
And is
Good question.
there a formal process? Like I guess I'm just trying to, no, okay.
Well, rulemaking,
Rulemaking is-
if there's rulemaking, the rules go through the legislative committee on administrative rules, and the chair of the committee of jurisdiction reviews the rules, but I don't know if rulemaking is part of this. Are there rules that would be?
I can't remember if there's rulemaking in the bill, is there?
I don't
I don't
believe
think
so.
Not required in this section.
Yeah.
Okay, I guess I'll have to think about that for a bit, because I still don't quite understand what that looks like over time. A yearly review,
Yearly review can be statutory, so we can ask for the commissioner to come back at a date certain. We can ask for a formal report. We can ask for an update in committee, a presentation. So it depends on what we ask for in statute,
gotcha.
or we can leave it out and then ask to have for an update on the timeline, for example, which you said would, it might be helpful to us to get that.
So will that be placed in statute, or it'll be left open?
It depends. I mean,
Maybe this
Casey,
is
you wanna-
Canadian, yeah.
Office of Legislative Counsel. So for the purposes of this bill, the language says shall seek and consider input from the committees. So what that would mean, it could be something like the exchange that Senator Hardy and the commissioner just had back and forth where, a concern was expressed and the commissioner heard that. It could be as simple as that. It could be more formalized, in which case it might be something like the committee comes together and writes a memo that expresses a concern or a preference. If there's something that the committee hears that the committee feels strongly about, you might work together and introduce a committee bill to address whatever you've heard. So those are sort of the methods you have for input.
Okay, so it's organic, so the concerns are coming organically from constituents typically?
Impacted, and there was a lot of, the reason why one of the versions, the House version of the bill had, legislative approval is that there was concern from stakeholders in communities across the state that the department wasn't gonna do what they wanted done. And so and then it came over to us, and we sort of worked on language about legislative input because of various federal and regulatory and separation of powers, and it was also confusing about what legislative approval meant.
Right.
So we changed the language But those concerns remain, just to make sure, and since we as the legislature are sort of ears on the ground in our communities, I think there's a lot of people who wanted to make sure that we had input because they could reach out to us directly, and you may start hearing from some of them, but we heard from a lot of them last year.
Okay.
And with some fairly serious concerns, but I know the commissioner also heard as well, so I think this was the sort of compromise that we came up with.
It'll crowd to get here, and we're not interested in opening it all up, that's for sure, but we are interested in correcting the sort of the technical glitch that happened as a result of the conference call. So and if we do that, it will give some reassurance to our constituents and probably also the department. So are there any other questions at this point? So if we could get something in writing that would help justify the date change, and including a simple explanation of timeline and how it fits in with federal oversight, or that would be helpful. And we will have you back at some point, I would think, to look at the broader picture. This is really important to a number of folks. Okay.
I'm happy to come back.
Okay, so that would be great. Any other questions? I'm just gonna have, I think what we'll do is we'll have Katie come back up and just quickly go through the bill again. And while you're here, Commissioner, that, then if we have further questions, we can send them your way.
Sure.
So you guys can switch seats.
seats.
Yeah.
You all of my powers. Sure. Okay. Just leave my bag.
Good morning.
Good morning.
Katie Mixon, Office of Legislative Counsel, and I am trying to join your Zoom meeting so I can share my screen.
Oh, good. Little Jill, lots of problems. Yes, sir.
Since this is our first rodeo,
Yeah.
we're the freshmen,
Uh-huh.
want to make sure we're actually looking at the right bill online. So went into to search for H1.
Go to Bill. Go to Bill. And when you get Bill,
It's actually attached.
Yeah, it's also in our,
It's on the,
yeah,
it's on our website.
it's on our webpage. So when you go to our webpage, you'll see a place where it says Bill, but next to date above. So you got date, and then you have Bill. And if you click on Bill, the first thing that comes up is H1. And then that's one we got. And then when you go to that, you'll see drafts, amendments, and legal documents, witness documents. And if you go to drafts, as passed by House 1/18/23, it's under our date, Katie McClynn's name.
As a note as well, senators, you can always access it through the date on the day we're discussing it. I add them there for each day it's on the schedule.
Going back up just a second. So I went into this, but I went in from a different direction. So I'm at the same point. So
Okay.
this is as introduced or
As passed by the House.
Official versus unofficial.
I usually tend to look at the unofficial version because it shows the changes integrated.
That's what I wanted to see.
But if you want to sort of see the exact change that was made, the unofficial version is gonna point you to those changes a little bit faster.
Thank
Yeah.
you all.
Good.
It's important to
Good question.
get the right version.
Okay, we set? Go ahead.
Okay, so this is H1, and last time we looked at it, it was the version as introduced. This is the as passed House version. You'll see that at the very top line, it's in all caps, as passed House, just to give you a sense of what we're looking at. So this means the changes from the House have been integrated. The one change has been integrated. So you'll notice, just because we have new members, unlike the previous version, you're not seeing a statement of purpose anymore, or which committee it was referred to. We're just starting right with the title and the enactment clause. And then section 1, this is payment reform and conflict-free case management, legislative oversight. If you remember our conversation from last week, this is the very same, this is identical language to what was adopted by the Senate in their version of H 720, with the exception of the phrase in the title legislative oversight to distinguish from the section that we are repealing. In subsection A, at a minimum, the following shall be included in the payment reform process impacting individuals with developmental disabilities, their families, and the designated and specialized service agencies, sometimes called DAs and SSAs. In addition to any standardized assessment utilized by Dale, a process for consideration of additional information relevant to the life circumstances of service recipients or applicants. Second, in addition to any standardized rates or rate ranges developed by the department, a process for consideration of budgets to reflect the individualized support needs of service recipients or applicants. And third, a process for evaluating the fiscal and service impact on individual service recipients and the DAs and SSAs. In subsection B, we're turning to conflict-free case management. Prior to implementing the federally required conflict-free case management system, the department shall seek and consider input from a variety of stakeholders, including individuals with developmental disabilities, their families, the DAs and SSAs, and other providers and advocates. As part of the changes necessary to come into federal compliance, consideration shall be given to performing initial clinical eligibility and service planning within the department. And this subsection C is the critical part. On or before February 1, 2024. So that's the change the House made, changing 2023 to 2024. The department shall present any proposed policy changes related to payment reform and conflict-free case management to the House Committee on Human Services and to the Senate Committee on Health and Welfare, and seek and consider input from the committees. Section 2 is important. This repeals the version of Section 6 that we didn't mean to enact, so that's being repealed, and this takes effect on passage. So take effect as soon as the governor signs it.
Okay, question, do you want to go back and look at the previous section 6 or any of the other parts of the bill as introduced? Anything you want to do there?
I have a quick question.
Okay.
This may not be quick, but,
The answer might not be quick.
I apologize if we've already discussed this, but can you give us a quick, even like one example? Putting aside the approval versus the input piece, what triggered this, this legislation, just generally out in the community, what was happening? Anyone?
Who would like to answer that?
Wait, can you restate your question?
She wants to know what initiated the legislation in the first place. What was happening out in the community that caused the legislation to be written?
That's a big question.
Yeah.
Can
you give one small example?
I think there were concerns about how decisions were being made for allocation of services for those with disabilities. And under our work from last year, there's a whole list of witnesses who testified. And you could probably look for one or two of those. And then the department came in and responded, and it was a lot of in-depth work on the part of all parties.
Okay.
So,
I can read some more of this.
yeah, and so the issue here isn't so much what drove the initial legislation as fixing that piece.
Right, no, I get it,
From conference.
but just having not been.
Having to understand it,
Yeah.
it's good.
Yeah, and because the state is out of compliance with federal law when it comes to conflict-free case management, that was another big concern, and that the way that that's playing out in the actual cases of people who are seeking services. And then just, there's some pretty bad examples of service delivery that's gone wrong in communities for very, very vulnerable adults. And So I think that was driving it, and the sort of tensions of how to resolve housing issues and care issues, and so it was a lot, and I couldn't cover it all, but we got a lot of testimony.
It was a lot.
Of people, yeah.
Well, thank you.
Commissioner, did you want to add anything to, as a response to that question?
Yeah, I think, so it's a good question, and the bill covers a lot of ground, as Senator Hardy noted, we are from the administration entirely in support of the work that the bill covers, to include a targeted focus on looking at development of alternatives for residential options, and we have work going underway on that, as well as we have been extraordinarily focused on being mindful to really have a robust community engagement process for all of the initiatives that we have under in motion right now. That was something that we had heard loud and clear, as noted from folks across the board. So we are we're very pleased with the legislation as a whole, and very glad to see that it be a legislative priority as well, recognizing it had been the most meaningful piece of legislation as it pertains to persons with developmental disabilities, possibly since the Developmental Disabilities Act was passed decades ago. So very grateful for that focus on how we, the state of Vermont, can better serve persons with developmental disabilities.
Okay, other questions? Okay, so if we can get, as soon as we get your written information that Alex can put on our webpage, and then we'll try to come back to this bill tomorrow and have consideration of a vote on the bill. But we'd like to have that, your information first, and we can do that.
Sure, we'll
Can you do that?
Well, I will see what I can do. I know I've
Okay.
been in testimony and this afternoon in a couple of committees, so I'm pretty much here all day, but I'll see what we could, who's back and able to pull something together. And we'll certainly do our best to put that around.
Whenever we get it, we'll put it there.
Great, thank you.
Okay. Anything else we need to know, Katie?
No, nothing from me.
All right. Any other questions that the committee would like to ask while we're on this topic?
So as it's amended now, it's just, can't do anything with it till it.
We can do whatever we
Oh,
want.
okay.
We could completely change it.
Or we could do nothing and not, and leave it
Or
on
we
our
could just
wall.
leave it
There's so many
sitting there.
possibilities.
We're now in charge of that bill. So if, based on the information that we've heard from people, do we want to act on it? Do we want to change it? Do we want to leave it up on the bulletin board, on the wall?
Based on what I just heard, it sounds like the wrong way now. I get the information from.
Okay. Yeah, and usually what we do is, when we take testimony like this, and the bill seems like it's pretty complete, I think there's been a lot of discussion, the House has passed it. The commissioners made justification for the date change. We've gotten the information we need that supports the bill as a whole. We understand the technical correction for the conference committee issue. And so in many ways, we're ready to act on the bill, to vote on the bill. But what we'd like to do are two things. One, we'd like to give ourselves a little bit of time to go through it, digest it, read everything, and especially the commissioner's comments. And then the second thing is to post a possible vote on our agenda so that people out in the real world know that is coming. So that's where, I think that's where we are right now, unless I hear differently from folks. Okay, all right, good. So we'll do that. It'll be great. Thank you, Katie. Thank you both for being here. Thank you today. Enjoy the rest of your day. And Alex, I think, tomorrow, just as a heads up, we will put that on the agenda at some point, H1, if we can get there. And we have David Englander coming in on the Prevention Council, and then we also have Owen Foster, who's chair of the Green Mountain Care Board, coming in. He's going to be presenting information about his role on the board. We're still live. He's going to on the board, and then we'll also consider asking some questions related to confirmation.
So formally or informally?
Formally. Well, we'll just see what time brings, and I'm going to communicate with him about that possibility.
So to that point, I think we made a request of Alex to try to get a resume, if that's germane to the conversation.
Yes, it is.
Okay.
I've reached out to ask for one, so if we get one, I will send it along to the committee.
Perfect.
Nomination.
Yeah, so our responsibility in here, when there are nominations to the Green Mountain Care Board, whether it's a chair or a member, we interview those folks. And then we vote on whether or not, to the full Senate, whether or not they should be confirmed. That's our job. And it goes no further than that, then that's the end of it.
Just to make one observation, I think it would be extremely beneficial to the freshmen that we do this first one, because it will kind of set the tone of what the expectations are about the conversation with the nominees for our follow-on other X number of.
Yeah. We'll see how it goes.
Things. Not very helpful.
We may not get to the confirmation piece. We'll see how. Experiment. Okay, so this is a wrap. Alex,